the total lockdown, particularly for now on Lagos, Ogun, and the Federal Capital Territory. I believe by the time I would cede the floor to the Honorable Minister for Humanitarian Affairs, Disaster Management and Social Development, she will give you a rundown of some of the palliatives that are being put in place in terms of the conditional cash transfer to the poor of the poorest, in terms of the school feeding program. In spite of the fact that schools have closed, the President has directed that the implementation of that program be sustained. That by the time the committee that is being chaired by the Excellency come on stream, they will roll out other palliatives. We are just starting. We are not very sure how long this will last. That's the truth about it. The countries that first got the affliction of coronavirus are still battling to come out of it. I believe, and by the sheer determination, spirited determination of Nigerians, would overcome these challenges. But I can rest assure you that packages will be rolled out. Like I said, the Honorable Minister for Humanitarian Affairs will give more details in respect of that. The other question has to do with conflict of policies. Somebody mentioned the fact that other states had locked down even before the federal government took its decision. If you read paragraph 29 of Mr. President's statement, it said that this current challenge will be guided and be guided, and it will be systematic, it will be and it will take into consideration any consistency between federal government policies and state policies would be eliminated. He was very categorical. That's the context of paragraph 29 of his speech yesterday. So that means that we are doing everything to ensure that there is uniformity of policies, particularly when it comes to highways, and other jurisdictions and territories that we might cross. The other question talks about time limit. It's a total lockdown, except for essential services, except you are going to access specific needs like medical needs, except you're going out to buy food. All those things were categorized in Mr. President's speech. So it's a comprehensive speech. I would urge all of you to get a copy of it and read through it, because we depend on you to broadcast the content of this speech to Nigerians so that they will know exactly where we stand in this matter. It's a national challenge, and we have to do everything within our powers and with the resolve and commitment and support of Nigerians to deal with the graph. I could see the expression of surprise on your faces when the Honorable Minister for Health said, today our record shows confirmation of those infected to be 111. It means that the graph is rising, and we need to do something drastic so that we can flatten that graph. If it continues to rise in that, very soon we'll begin to count much more bigger figures than what we are counting now. So my appeal to all of us, using you as the instrument, is to appeal to Nigeria that nothing would happen to us if we lock down for these 2 weeks and allow for the tracking of those that have been in contact with those infected, so that we do not transmit to community transmission. Thank you. Minister. Okay. Oh, okay. I thought she would finish up with my part of the question about what government is doing.
Thank you very much, Mr. Chair, distinguished ladies and gentlemen. Let me be specific on the task given by Mr. President to our ministry. Mr. President, in his speech, mentioned the provision of relief materials to residents of satellite communities. And in paragraph 49 of that speech, Mr. President said that residents of satellite and commuter towns and communities around Lagos and Abuja, whose livelihoods will surely be affected by these restrictive measures, we shall deploy relief materials to ease their pains in the coming weeks. And to achieve this, we must identify and reach the targets of such communities and residents using available data at our disposal. This we have started doing. NEMA has deployed all the trucks. They are on site. And before the end of today, these trucks will be deployed to these affected states, Lagos, Ogun, and Abuja. On the issue of the school feeding program, Mr. President mentioned in his speech, paragraph 50 of that speech, he directed that our ministry works with the relevant state governments in developing a strategy on how to sustain the school feeding program. This we'll be doing, and I've already started contacting the governors on agreeing on the modalities to adopt, and I have accordingly contacted the program heads of this program. And this particular tax may really may have to go beyond the affected states, because as we are aware, all schools are closed down and children are at home. So we are looking at these modalities to see how we extend this directive to even the states where the lockdown has not affected. Mr. President also in his speech of paragraph 51 has directed that a 3-month repayment moratorium for all trader money, market money, and farmer money loans be implemented with immediate effect. This we have also carried out that directive. We have met with the officials that are handling this program under the ministry, and we have directed that they implement this immediately. In Mr. President's speech on paragraph 54, he has also directed that the conditional cash transfers be given in advance of 2 months. This we have also called the program heads, and we have directed that we start immediate payment of this cash transfer to the most poorest and vulnerable households in our country. Let me also reiterate here that because of this COVID-19, the vulnerable groups have to be expanded, because we are aware that we have people who live on daily wage. And so we're also going to look at those groups of people to see how we can take this food relief intervention to them in these affected areas. Thank you.
Thank you, your Secretary of Government, Honourable Ministers. The questions for the Ministry of Health revolve largely around testing and also who is eligible. I need to say that from what we know so far, and there are many, up to 80% of people who contract the coronavirus disease either show no symptom or very little mild symptoms. And of the remaining 20%, about 15% can be quite severe, and about 4 or 5% is critical. Now, you'll be discharged from treatment if you look well and you test negative 2 times. And until it's proven that you don't have any more of the virus in your system. That usually take anything from 3 to 4 weeks or a bit longer. If you are tested and it's negative, after 24 hours or past 48 hours, you are tested again, you are negative, then you are good to go. So anybody who meets that criteria, the criteria will now be declared free and can go home. As to who is tested, first, it is important to know that this is an imported pathogen. It's not indigenous. So it was brought from outside the country. Therefore, in order for you to contract coronavirus, you have to have been abroad or you have been in close contact with someone who was abroad and brought it. So if you never had a contact like that, and you also haven't been abroad, it's very unlikely that you are a coronavirus victim patient. But because it's coronavirus disease is in every mouth, there are people who, once they feel feverish or they don't feel quite well, they think it's corona and they want to be tested. So the NCDC tries to discourage people like that. It's not something you acquire like malaria or yellow fever. You have to have these criteria.
And what you're watching now is a joint briefing between the Presidential Task Force on Coronavirus and the Ministry of Health. According to the Secretary to the Government of the Federation, this briefing will hold daily at 2 p.m. and is in order to furnish Nigerians with authoritative and adequate information about new development. The SGF also said the President has set up an Economic Sustainability Committee headed by the Vice President Yomi Osinbajo to put palliative measures in place for Nigerians at a time like this.
So we don't want to waste any of them.
And now to bring you more updates on the coronavirus in the country. All hope is not lost in the fight against the novel coronavirus.
Tested, so it's a little bit expanded to accommodate any errors that might arise, or to also put certain people's minds at rest. Now, the other questions about testing centers, since last week, we added Ibadan, UCH Ibadan to the list, and I already read out others that are coming next week. We have the capacity to convert some of the machines that we use for testing TB, that machines. We have the capacity to also test the coronavirus. The machine is there, but if you do not convert it and you do not have the reagent, you don't have anything to recognize the virus, then the test is not possible. But if we can conclude the conversion of these machines, of which we have about 3 centers in the country, but that will not take place for at least 1 month or 1.5 months, because the protocol for so it's possible to obtain samples from various. In fact, many countries do that. Use one machine, then you are utilizing it properly. So we do not want a situation where you have machines that are idle, but also have enough to go to conduct the test. As we have been speaking with state governors, I had the privilege of joining in a teleconference with governors yesterday, and we discussed the issue of seeding out of coronavirus from the main hubs to the states, and also the isolation centers. We have urged every state to have an isolation center. Many of them have isolation centers for B and so on. But for this particular pathogen, yes, they are trying to use very centers. Even if it's a hotel, you can hotel that in fact those ones are very good because we have single rooms. You can stay in their room. Past the 14 days. Mild up to moderate cases can be even treated in those areas, but we have also said that every treatment center, every isolation center, whether at the federal or state level, has to be accredited. It must be accredited as fit to handle treatment of a disease that can be so terribly infectious, because there's high risk not only to other people who are around there, but even to the staff who are doing the treatment. As you know, in Europe, many people who are helping to treat coronavirus have themselves become infected. So you must know that you have people there who have been taught the protocol for treating coronavirus disease, well supervised, and the facility is together that the Professor Abayomi in Lagos, who will accredit every center that wants to handle coronavirus. And if started, you'll be visited and you'll be told to correct errors if there are any errors in your treatment arrangement and protocol. So the relationship with governors is very good. We are working together, and we are hoping that if we take they pursue them very well, very diligently with contact tracing and identification and testing and isolation. They can take care of those cases. Just the way the index case, the Italian that came here, just the way he was taken care of, he was discovered within 48 hours. The contacts were traced, 179 of them. One was positive, they were treated, everything went well, they were charged, and the class ended like that until we had a large number of cases that came in now, and that caused the situation that we are in at present. I think I've answered all the questions that are connecting to the health sector.
Honorable Minister of Health, we shall just allow one more question from Premium Time, the question that came in while you were speaking.
Good afternoon. My name is Nikki Adebowale, I report for Premium Times. So, sir, interferon alpha 2 has been said to be to the treatment of COVID. So, are there plans of the government using this drug? Also, is there any workers from Cuba to try the drug in Nigeria? Thirdly, sir, you mentioned that someone else died over the weekend. The second person died. Can you give us a name and a location, please? Thank you.
The health sector never divulges the name of patients who have been in treatment. It's against the ethics, so nobody's going to tell you the name. We can talk about the ailment without talking about the person, or you can talk about the person without talking about the ailment, so we don't disclose names. As for on clinicians, those are the ones who are handling the cases. The area they also devise what they want to use, and the WHO provides guidance in that because they have global experience, they have scientists, they test a lot of all these things, they have laboratories where they carry out, they compare and also contrast, and then they advise countries on treatment protocols. Of course, there are countries who want to do it the way they want. There are some countries who want to use this or that method of treatment. They are free to do so. We have heard of chloroquine, and we have said that Lagos can go ahead and try it. It's called a clinical trial to see if it actually works and contribute to the body of knowledge about the efficacy of chloroquine. And also the other one called hydroxychloroquine. Lagos is going to try large number of patients, and the experience from trying these medicines will be published. We know. You were talking about doctors from Cuba. Yes, we're not in touch with them. We have enough doctors here who are handling in fact, I'm supposed to meet with Nigerian Medical Association. We want to be able to bring out retired doctors and NMA doctors to volunteer to help. We're not a short of doctors.
Before I invite the SGF to respond to one of the questions, we will take just a second round of questions, beginning with Jaisemi from AIT.
Thank you very much. My question is to the task force, but particularly to the Minister of Health, Dr. Enahire. Sir, we want to know in specific terms, what's the number of ventilators that we have in the country? That's number one. Number two is, what's the volume of test kits on the ground? We know the entrepreneur center is about 20,000. Why I'm asking this question is that if you look at what's happening in other clients that have these challenges, these are the questions that policymakers and top officials are having amongst themselves. And when you have these questions posed to you and you give the answer to Nigerians, there's this assurance that, okay, yes, this is what we have. Everybody keep calm. We're doing what we need to do for you.
Do we have any other questions from the floor? Come back and redirect the question.
Yes, I'm going to answer that.
Okay. Yes.
What was the question? Was it the question that had to deal with donations? I answered the one about traveling by referring you to paragraph 29 of the President's broadcast, where he spoke explicitly that where there are inconsistencies, they will be resolved. So we will take steps to resolve those inconsistencies. The President has spoken, and obviously the statement of the President as to the lockdown would take priority in terms of implementation over and above whatever any other person has done. Do you get the answer?
You can approach the mic and redirect the question.
Yeah?
So people are already stranded in places like Delta, you know, and they were told they will be there for as long as the lockdown remains. So I don't understand. Are they going to be there for the 2 weeks? People are stranded on the road. They can't get to their destination. They can't go back. What solution can be made available at this time?
Well, my answer was very, very clear. I referred you to a particular paragraph. We are mindful of the fact that there are those inconsistencies in policies. Some states began to implement their lockdown even before the President's broadcast. The President's broadcast was very definitive and categorical. We are only locking down Lagos, Ogun, and the Federal Capital Territory. Those are the only 3 designated areas for the lockdown now. We would approach, if by the time we finish this meeting, I will make some calls, I will find out from the security agencies what is happening in those borders. I expected that after Mr. President's broadcast yesterday, what should ordinarily happen is that if you had stopped people from getting to their destinations, that broadcast should have enabled you to release those people to get to their destinations. You can put proactive measures as a toll gate to ensure that you test them and allow them to get to their destinations. That was what we did at the airports before we finally locked down the airports. We gave time. These things, like he said in his paragraph 29, would be systematic, would be consistent, and it will be based on best practices. So do that. The other question that was asked was with regards to donations. Well, there have been announcements from different quarters. I will start from our donor partners. But we've received commitments from the EU, from a couple of other international bodies, the EU, the United Nations Group, the Nigerian Economic Summit Group, and the corporate Nigeria. We have received donations, we have received pledges from different organizations and individuals. And the coalition of the private sector, ably led by the governor of the central bank and Alhaji Aliko Dangote, about 2 days ago, I think the governor of the central bank, on behalf of that coalition, announced through a press conference in Lagos, you must have seen it, where the coalition of private sectors in Nigeria have made a commitment to deploy resources to the tune of about 120 billion naira in their aid to ensure that collectively as a people and with the cooperation and support of the government that we deal with this pandemic. I believe they are going to own up to their words. We've been talking with them. Even this afternoon, I spoke to Alhaji Aliko Dangote. I've been speaking with the governor of the central bank. They have asked for the list of items that we need to build capacity and ensure that we have sufficient consumables, testing material, ventilators and the rest. And that list of equipments have been sent to them.